Hey guys, Dr. Jeremy Rahauser from Village Chiropractic Center here. Today we are going to talk about upper extremity conditions, anything involving the arm. Starting at the top, you have your shoulder. Common shoulder issues are typical sprains, strains of the rotator cuff. You have a lot of people say they have rotator cuff problems. That usually involves either a sprain strain component or a tear. You also have the labrum, which is where your hip is a bony ball and a bony socket. The shoulder is a bony ball and a soft tissue socket. That soft tissue socket is made up of the rotator cuff tendons, the supraspinatus, infraspinatus, teres minor, subscapularis. So those actually, over repetitive stress and injuries, can actually sprain, strain, or even tear. And I'll have Micah talk to you about some of the therapies and some things we do with that. From a nurse practitioner standpoint, we have cortisone injections, trigger point injections, which is Toradol, which is a non-steroidal anti-inflammatory, as well as any other analgesics, painkillers, muscle relaxers, anti-inflammatories on the prescription side. Chiropractic, we do joint mobilization to increase range of motion and increase fluid circulation and decrease inflammation. On the medical massage side, the medical massage do transverse friction massage, PNF stretching, myofascial work, deep tissue work to actually help heal and restore motion to the damaged tissues. And then I'll have Micah again talk to you about some more of the therapy things. In regards to the elbow, you have tennis elbow, golfer's elbow, are kind of the common elbow issues. The golfer's elbow involves the medial epicondyle, which involves the flexors of the wrist. Tennis elbow involves the lateral epicondylitis, which is the extensor tendons of the wrist. And we do have some therapy and some bracing that we do on that. Chiropractic, again, restores motion. Nurse practitioner on all of these conditions with their soft tissue. Trigger point injections, joint injections, and analgesics. And on the medical massage side, all of the myofascial release, active release therapy, nerve stretching, all those type of things from the medical massage standpoint. Wrist, two common wrist injuries. Carpal tunnel, you always hear of. You have a flexor retinaculum, which is like a wrist watch. It's a flexor ligament that runs over your wrist. You have the median nerve, which runs underneath that flexor tendon. And when you have repetitive stress, that actually causes that flexor ligament to expand, tighten up, contract, and it pinches the median nerve. Typically radiates into the palmar side on these three fingers, but it can actually involve kind of the whole hand, numbness, tingling, dropping things, that sort of thing. We do joint injections on that. Medical massage really helps from a transverse friction massage, chiropractic to restore motion to the carpal bones, to the radius and the ulna on the distal end, as well as some bracing and some therapy that we do for that as well. The other wrist common issue is called de Quervain syndrome, which is stenosing tenosynovitis. Don't memorize that word, but it's tendinitis of the thumb extensor, and it used to be called blackberry thumb when cell phones started coming out. Now it's really like text thumb, where you're constantly abducting that thumb and contracting that tendon, and it gets inflamed, and the sheath gets inflamed, and you can actually get cystic swelling and inflammation in there as well. Injections really help with that. Adjusting the thumb helps with that. Myofascial release with the massage therapy helps with that. There also is a de Quervain's brace that we can give to help with the rest, ice, compression, elevation, stabilization component of the rices, and then we ask patients to do some at-home things as well. But I'm gonna turn it over to Micah. That's a lot of information. You can rewind and play as you need, and call us if you have any specific questions of any condition you think you might have, and I'll let Micah hit on some of the key therapies.
So whenever you're being treated for one of these conditions, typically the doctor will bring you out to us, and we have several things that we can do as far as a line of defense to help with that. The first thing we're going to do is the TENS unit. That's a little electrode pads. We see a lot of shoulder, like he said, shoulder, elbow, wrist injuries. First thing we're going to do is get you in the therapy base. We're going to do the stem either around the joint, wherever the muscles are acting up, that's going to get them to release endorphins and help to break down and just distract from the pain. So we're going to hit it with the stem unit. We also use tape. A lot of the time we use a lot of kinesio tape for these types of injuries. It helps to kind of change the neurosensory input. Your skin has a lot of nerves, and it helps to change the way your brain is feeling the pain, and it also helps to stabilize the joint. We mainly use it to reduce inflammation, but a lot of times for shoulders, wrists, and elbows, we use it to help you guys just get through the day so the pain is not constantly on your mind, and you can use it without overusing or underusing it, trying to baby it.
I can interject one thing on rock tape. It's really cool. When you look at it, rock tape under an ultrasound, it actually separates the tissues of the skin. So it's like folding like pushing on both ends of a deck of cards where they fan out, and it'll actually do that to the layers of skin, which will open up channels to allow inflammation to go away and new blood to come in. So rock tape kind of does what the body needs it to do without you really having to control it. The rock tape does it for us.
Absolutely. So we use a lot of that here. Many of you guys have actually tried that. It lasts several days, so it's not just a one-time thing. It'll last you quite a while. We use that a lot. The same company that makes our tape actually makes rock floss as well. This is similar to a compression type of therapy. You wrap it around either the joint or the muscle that's affected, and you do range of motion, non-weight bearing and weight bearing exercises to kind of trick the brain into thinking, okay, this joint is now stabilized, or you can use it to also specifically manipulate the muscle grouping. So we started using this a lot more as well, specifically for those tendonitis, shoulder injuries, even knee and ankle as well helps to stabilize. But this is great for tendonitis as well. Like Jeremy said, whoops, we have tons of braces here as well. This is specifically just an elbow brace. This helps to just keep the area stable and prevent those the ligament. It changes where the ligament is going to kind of attach, and so when you're having that pain, it kind of can change that connection point.
Actually moves the origin and insertion to the pad side of the brace, locks down the injured area, so when you're extending and flexing your wrist, it does not contract and relax at the insertion where the tendonitis is. So it helps with that rest and stabilization component of the rices that we talked about.
We also do formaling here. I know we have a couple videos about this already, so I won't go too much into this, but this is basically a good way to give yourself your own deep tissue massage. It can help to limit spasms and just keep you generally loose and kind of in line. It's going to keep those muscles happy. We're happy to show you how to use this. If you ever have a question or want to purchase one, we'll go over with you how to use it for your specific area. And last thing, we've done a couple videos about this as well. This is our cold laser. We use this on a lot of patients with chronic injuries. This is going to help to increase the cellular production and kind of give the cells the energy that they need to activate. And so it'll speed up your healing process. We often use this to reduce inflammation, or if you have a fracture, a tear, it can help to heal that area a lot faster. So if you guys have any questions, like you said, give us a call and we can help you out.
Thank you, Micah. And Micah is our therapy manager, so she's all-knowing in the therapy department. And she's here all the time too, so feel free to ask her any questions. Extremely approachable, as you can tell. So any questions you have, please call us at 972-317-3146. Again, Village Chiropractic Center, thank you and have a great weekend.
Bye guys.